This is the second lecture in Unit 7. The thyroid gland sits just below the larynx. There are two types of cells, the follicular cells which produce T3 and T4, and the parafollicular cells or C cells that produce calcitonin to inhibit the osteoclasts. It is involved with increasing the metabolic rate, decreasing cholesterol levels, and increasing body growth, especially lean body growth. Because it plays a role in controlling metabolism, which includes all chemical reactions in the body, several areas of the body feel the effects of the thyroid gland. Thyroxine or T4 is the storage form of the hormone. It is called T4 because it has 4 iodines and is converted to T3 by removing one of the iodines. This will spend more time in the bloodstream and is slow to activate. This is often replaced with drugs such as Levoxyl or Synthroid. Triiodothyroxine, or T3, is the active form of the hormone with only 3 iodines. It is faster acting and shorter lived in the bloodstream. This is replaced with drugs such as Cytomel or liothyronine. These often have their effects felt much quicker, but are also active a much shorter time. T4 is found in higher quantities and T3 in lower quantities. Both T3 and T4 combine with transport proteins, mainly TGB. Although it is most common to replace T4 only, there is some evidence for using a combination of both T3 and T4 in recent studies. This slide shows the negative feedback control of thyroid hormone. In normal thyroid activity, the pituitary releases enough TSH to stimulate the thyroid gland to produce T4 and T3. In hyperthyroid, because the levels of T4 and T3 are too high, the pituitary responds by lowering the release of TSH, stimulating the thyroid. In hypothyroid, the T4 and T3 levels are too low, so the pituitary attempts to correct this with high secretion of TSH in attempt to increase production. The control of the thyroid gland is by negative feedback, monitoring the levels of T4 and T3. Calcitonin is also secreted by the thyroid gland. It will decrease the blood calcium levels by inhibiting osteoclast activity. We're going to watch a tutorial that is produced by Biology in Motion. So here it's going to show the negative feedback that is important for regulating the amounts of substances in the body. This tutorial shows how the thyroid gland works together with the pituitary gland and the hypothalamus of the brain to regulate the level of thyroid hormone. You will also have access to this tutorial afterwards. So it begins with stimulation of the thyroid hormone secretion. TRH is secreted by the hypothalamus. This stimulates TSH secretion by the pituitary gland. This stimulates thyroid hormone secretion by the thyroid gland. Looking at the regulation, thyroid hormone inhibits TRH secretion. This reduces TSH secretion. This reduces thyroid hormone secretion. Looking at iodine deficiency resulting in goiter, without iodine, thyroid hormone cannot be synthesized from its precursors. The absence of thyroid hormone promotes TRH secretion. This stimulates TSH secretion. This stimulates the synthesis of thyroid hormone precursors, which accumulate and enlarge the thyroid gland. Goiter is easily prevented by including a small amount of iodine in the diet. There is an additional tutorial here to view on your own, where you can go through the sections titled Introduction, Anatomy, the Hyperthyroidism, and Hypothyroidism. Thyroid hormones increase our basal metabolic rate, help increase the use of oxygen to make ATP, and increase the metabolism of carbohydrates, lipids, and proteins. It increases the synthesis of sodium and potassium pumps and increases the body temperature from ATP use. They stimulate protein synthesis, increase the use of glucose and lipids for making ATP, and improve cholesterol levels by enhancing secretion. It enhances the actions of some of the catecholamines like norepinephrine and epinephrine by creating more receptors. This increases the heart rate and blood pressure and increases the forcefulness of contraction. Thyroid hormones increase body growth with human growth hormone and insulin. They also interact with serotonin and estrogen. The parathyroid glands are 4 small glands on the sides of the thyroid gland. They will provide the opposite effect on the blood calcium levels from the thyroid. PTH, or parathyroid hormone, will increase osteoclast activity to increase both calcium and magnesium levels in the blood. It will also increase the phosphate loss through the kidney to decrease blood phosphate. It will also trigger the production of calcitriol, which helps to increase the amounts of calcium and magnesium absorbed in the gastrointestinal tract. Control of the parathyroid is through negative feedback monitoring of blood calcium levels. The pancreas is both an endocrine and exocrine organ. We will look at the exocrine functions of the pancreas and the digestive system. The endocrine portion of the organ is the islets of Langerhans. It has 2 types of cells, the alpha cells which secrete glucagon and the beta cells which secrete insulin. Glucagon increases blood glucose levels by putting more sugar into the bloodstream. Insulin decreases blood glucose levels by helping the cells to take up and use glucose to get it out of the bloodstream. Insulin helps cells take in glucose. Without insulin, cells are not able to use the sugar. Insulin essentially tells the body there is plenty of food available, so it is time to repair and store. It will also promote glycogen synthesis, which is the sugar stored for quick use in the liver and muscle. It increases protein synthesis for repair and building muscle, and increases fat stores for the future. Insulin is also stimulated by acetylcholine, the amino acids arginine and leucine present after a protein meal, and glucose-dependent insulinotropic peptide. Glucagon helps increase blood glucose by releasing sugars from other sources. It tells the body it is short on food. Glycogen will be broken down from stores in the liver and muscle. Gluconeogenesis, which literally means making new glucose, will increase to make more sugar available in the bloodstream. The body will break down protein from the muscle and other tissues to make more sugar, as well as tapping into fat stores. Glucagon is also stimulated by sympathetic activity, so it can help increase glucose available in the bloodstream, and having increased blood amino acids following a meal that is mainly protein will also increase the levels. There is a link here for you to follow that's going to show a comparison of how other hormones affect the blood glucose levels, since it is more than just insulin and glucose that affect it. There's also a short quiz to complete at the end of that activity. The adrenal glands sit like caps on top of the kidneys. The outside we have the cortex, which makes up about 85% of the adrenal gland. The cortex produces the mineralocorticoids and glucocorticoids. The mineralocorticoids are hormones affecting mineral homeostasis. Aldosterone promotes the absorption of sodium and the secretion of potassium. Renin stimulates the formation of angiotensin II to raise the blood pressure by increasing sodium and water retention to raise the blood pressure. Angiotensin is converted to angiotensin II, causing vasoconstriction. The glucocorticoids affect glucose homeostasis. Our hormone for this job is cortisol. The synthetic form of the hormone is cortisone. Cortisol is released in response to stress and works to increase the amount of glucose available to help you respond to the stress. It does this by breaking down protein and triglyceride and promoting glucose formation. It is anti-inflammatory and decreases the immune response so that it does not slow us down in the time of crisis. Due to the breakdown of protein, it decreases tissue repair and slows wound healing. The androgens are masculinizing sex hormones released by the adrenal cortex. The androgens are derived from DHEA or dehydroepiandrosterone, which is a precursor to many of the steroid hormones. The effects are more noticeable in females than males due to the large amounts of testosterone in males from the testes. These are responsible for the sex drive and some secondary sex characteristics such as axillary and pubic hair. In the steroidogenic pathway, this hormone can be converted into estrogen in some situations. Control is not fully understood, but it is stimulated by adrenocorticotropin hormone, or ACTH. The adrenal medulla is the center of the adrenal gland, and its activity is tied to the sympathetic neurons. It will release epinephrine and norepinephrine to help augment the fight or flight response during stress. The gonads are the organs that produce the gametes or sex cells. In females, these are the ovaries. They produce estrogen, the female sex hormone responsible for regulating the menstrual cycle. Progesterone is also produced here and helps to maintain the endometrial lining in the pregnancy. Relaxin helps to increase flexibility of the joints, particularly the pubic symphysis, to help deal with the growing fetus. The testes are the male gamete and produce the male sex hormone testosterone. The pineal gland is familiar from covering the nervous system. It will secrete melatonin, a hormone that makes us sleepy. Light inhibits production to keep us awake during the day, and dark allows the production, making us sleepy at night. The commonly used model for explaining the response of the body under stress was developed by Hans Selye and is called the general adaptation syndrome. A stressor is defined as any change in the environment, whether it be physical or emotional, pleasant or unpleasant. The first phase is the fight or flight phase or alarm phase, where the sympathetic system initiates a short-lived response. The body is not able to sustain this for very long, even if the stress does not go away. Since the nervous system cannot sustain the response, the hypothalamus triggers the endocrine system to sustain the response. This phase can last longer. CRH triggers the anterior pituitary to release ACTH and the adrenal cortex to produce more cortisol. This helps to make more glucose available to the muscles, but can also break down a significant amount of muscle tissue if enough is released over a short period of time. Growth hormone releasing hormone triggers the anterior pituitary to release human growth hormone and IGFs from the liver, also increasing the availability of glucose. TRH triggers the anterior pituitary to produce TSH and the thyroid, T4 and T3, to help the body more effectively use the sugars available. This slide shows the initial burst of energy in the fight or flight stage and how it drops off to allow the lowered resistance phase to kick in. Here we start out with the full energy, it drops off, and the lowered resistance phase kicks in. Eventually we use up the resources available in the lowered resistance phase and progress to exhaustion. During the exhaustion phase, the body is no longer able to sustain the resources to continue the lowered resistance phase and becomes depleted. Here we have muscle wasting from breakdown of muscle for sugar. The immune system is depressed since valuable energy is not wasted on immune responses. Beta cell failure may be seen in the pancreas from the overload of work processing the sugar, putting the person at greater risk for diabetes. We see an increase in stress-related conditions, and the list of these is growing. There is worsening of chronic conditions. Inflammatory conditions are common, such as gastritis, colitis, irritable bowel syndrome, ulcers, and other symptoms like hypertension, asthma, rheumatoid arthritis, and migraine headaches. It can also affect the emotional states with anxiety and depression. There is an increase in fibromyalgia, chronic fatigue, and premature death. We're going to watch a short clip on the stress response. So this one states that stress can be physical, such as loud noise, cold temperature, strenuous activity. It can also be psychological, such as anxiety, guilt, or joy. Each person's threshold to stress is different, but stress is a fact of everyday life for everyone. The hypothalamus receives information from almost all parts of the brain, including the limbic system, the emotional brain. The hypothalamus responds to signals of stress by recruiting the sympathetic division of the autonomic nervous system, also called the fight or flight response. The body prepares for fight or flight response by shunting blood from the skin and digestive organs to the muscles, providing more fuel through the increase in glucagon action, in other words, releasing glucose from stored glycogen. The hypothalamus stimulates a release of ACTH from the anterior pituitary gland to increase cortisol levels from the adrenal gland. Cortisol helps to supply cells with amino acids and fatty acids for energy supply, while diverting glucose from muscles for use by the brain. Cortisol and related compounds are sometimes used to reduce inflammation, but the concentration necessary for inflammation reduction is toxic to the body. These drugs must be carefully monitored. The first step in confronting any type of stress is to respond to the fight or flight system as its functions dictate. Physical exercise that expends energy, such as running, jumping rope, fast walking, will help recycle the various hormones and secretions to bring the body back to homeostatic levels. It's much easier to solve problems in a more tranquil state. This link is also available for you to watch after this presentation. This slide demonstrates the connection between many of the hormones in the endocrine system and the brain and in the immune system. In the additional sources, you will be able to pull up the link where this particular picture came from so that you can print an enlarged copy if you would like. The thymus contains endocrine tissues that produce thymosin. Thymoic humoral factor, thymic factor, and thymoprotein promote the maturation of T cells and may retard aging. Other gastrointestinal tissues are going to have some endocrine tissues in them as well. Gastrin increases the gastric juice produced and increases stomach movement. Glucose-dependent insulinotropic peptide increases the release of insulin, and CCK or cholecystokinin triggers the release of bile and promotes a feeling of fullness. The placenta produces HCG or human chorionic gonadotropin, which increases the production of the hormones progesterone and estrogen from the corpus luteum to maintain the pregnancy. Human chorionic somatotropin promotes the development of mammary glands for lactation. There is absolutely no evidence that HCG promotes weight loss or spares muscle breakdown in dieting. The endocrine tissue in the kidneys produces renin, which helps to increase blood pressure, EPO to increase red blood cell production, and calcitriol to increase calcium absorption. The heart produces atrial natriuretic peptide to decrease blood pressure. The adipose tissue produces leptin that suppresses the appetite. Leptin may increase levels of FSH and LH. Ghrelin is a hormone that increases the appetite, and high fructose corn syrup tends to suppress leptin. These connections between leptin and FSH and LH are one of the reasons why watching body weight is so important for polycystic ovary syndrome. The eicosanoids are derived from the fat arachidonic acid. The prostaglandins alter smooth muscle contraction, glandular secretion, blood flow, reproductive processes, platelet function, respiration, nerve transmission, lipid metabolism, immune responses, and promote inflammation, fever, and pain. Another eicosanoid is thromboxane, which is modified prostaglandin that promotes vasoconstriction and platelet activation. The leukotrienes promote the chemotaxis or movement of white blood cells and the mediation of inflammation. The NSAIDs work by inhibiting an enzyme in prostaglandin synthesis. The growth factors are mitogenic substances that cause growth by stimulating cell division. We will look at 6 examples here. Epidermal growth factor is produced in the salivary glands and promotes growth of epithelial cells, fibroblasts, neurons, astrocytes, and inhibits some cancers. The platelet-derived growth factors are produced in the platelets and play a role in wound healing as well as atherosclerosis. The fibroblast growth factor comes from the pituitary in the brain and stimulates the formation of many types of cells, angiogenesis, and tissues from the mesoderm origin. Nerve growth factor is produced in the salivary glands and hippocampus of the brain and promotes the growth and differentiation of nerve cells. Tumor angiogenesis factor is produced by both normal and tumor cells and stimulates the growth of capillaries, wound healing, and organ regeneration. 2 types of transforming growth factors are TGF-alpha and TGF-beta. TGF-alpha acts similar to the epidermal growth factors in promoting growth, while TGF-beta inhibits the proliferation of many cells.